You're welcome to Village Square Africa. My name is Keminni Amanor. Now, today is International Day for Epidemic Preparedness. It's a day set aside to create awareness on the need for countries around the world to prepare for any kind of epidemic. Mind you, coronavirus is still with it. It has morphed into a new variant called the BF7. And the question that should be on your mind as an African is, are your governments ready for whatever the future epidemic could be? That is why we are having this conversation. You should stay with us and find out what we could do to prepare ourselves better. International Day for Epidemic Preparedness has been set aside to raise awareness among countries to prepare for disease outbreaks, whatever the size, be it an epidemic or pandemic. 3 years ago this month, the world awoke to the coronavirus, which later degenerated into a full-blown pandemic pretty quickly. The flu-like disease exposed the weaknesses and inequalities of public health systems around the world, and Africa was no exception. The outlook for African countries did not look good. Scientists projected bodies will pile up on our streets. During the 2-year peak of the pandemic, economic activities slowed down or halted in some cases. Health systems were overwhelmed and vaccines didn't readily become available in parts of Africa. In places where they were available, those countries bought them at exorbitant prices. Despite these challenges, bodies did not pile up on the streets as scientists predicted. The opposite actually happened. There were fewer deaths in Africa, and we still don't understand the science behind that. Some theorize that it could be a result of Africa's largely youthful population and the very high temperatures here. But nothing is known for sure. This is not to say there were no COVID-related deaths on the continent. There were, and even one life lost to this infection is one too many. Disease outbreaks have become a part of human existence. Some say it is nature's way of pruning, but others believe much of it is human doing. That has us wondering, will Africa be lucky again if there is another pandemic? What kinds of actions should our leaders be taking now in order to adequately prepare citizens for future diseases? That's our focus on the square today. I'm Keminni Amanor, and you're welcome. Joining our gathering also are two gentlemen, Adefolarin Opawoye. He is infectious disease team lead at the Lagos COVID-19 response team. And then we also have Peter Imoesi. He's research fellow at the School of Medicine, Medical Sciences and Nutrition at the University of Aberdeen in the UK. Gentlemen, you're welcome to the square.
Thank you.
Thank you very much.
Wonderful. Folarin, I'll start with you. What really is the significance of this day as far as you're concerned?
Well, I mean, this is a new day in the International Health Days, which was just started about 2 years ago now, which was supposed to be a direct response to the challenges and the struggles that we faced with the COVID-19 pandemic, because it was something that really caught the world unawares and millions of people died. And, the way we actually learned from the history is to avoid repeating the mistakes. And so the whole idea of the day was to try to create a situation where what happened to us in 2020, 2021 will never happen again.
I see. And Peter, when you look at the kind of response this day has had since 2020, do you believe it's achieving anything?
I believe we've learned one or two things when it comes to response to future pandemic. Many countries have been able to build sustainable infrastructures in place, and the populace are much aware when it comes to pandemic and diseases right now. So the level of sensitization across the world, in Africa, Central Europe, and across every other country, everyone understands basically that you have the WHO in place. People know that we have the NCDC in Nigeria, which is responsible for this kind of outbreaks. So basically, I think we've learned a little bit of what to do, but there's still room for improvement going forward.
Very well. Let's look at the world response to the pandemic that necessitated this day, COVID-19 pandemic. How do you think the world did in handling the pandemic? And, how does it compare to, say, how the world responded to Ebola? Adefolarin?
It was obvious that COVID-19, the two diseases were a bit different. And that's one of the health inequities that we're trying to challenge in global health, because Ebola was a regional problem. It was mostly West Africa. And until we started having cases imported from West Africa to the US before they actually stood up to take attention, to pay attention, it was largely neglected in a way. Unlike COVID, and you see the response to COVID. I mean, you really have to be impressed that within about 8 months of a new disease, we were able to get the vaccine, while we've had diseases that we have been ravaging Africans for hundreds of years, and nothing has been done. So it's that tilt, and I mean, for me, the challenge is just that as Africans, we also need to rise up for ourselves and stand up to be counted and do our own work, and not just rely on the West to spoon feed us. But it was very clear that unlike so many other epidemics and pandemics that have been ravaging Africa for years, because of the global nature of the COVID-19, a lot more resources were diverted to it, and we can see the results. I mean, in vaccines, we had so many vaccines that were produced very immediately. There was a lot of money invested, a lot of money was also made, unlike what happened with many of these other viruses. So it's funny that Ebola, we still really don't have very reliable vaccines, especially against different variants, unlike what happened with COVID. So the response has been quite lopsided when you look at these two diseases. And you can say the same thing for Lassa fever and so many other conditions that's mostly ravaging sub-Saharan Africa compared to a global issue. So it's just for all of us to just sit up and try to do our own work by ourselves. That's the lesson for me.
Very well. Peter, how would you assess Africa's response to COVID-19?
It's really difficult to kind of assess the response when it comes to Africa as regards to COVID-19. You need to look at several variables. Number one is, what is the level of infrastructures when it comes to research? Also, since we're speaking about the COVID, we also know that when it comes to the level of fatality on the continent, it wasn't as predicted that we're going to be having dead bodies on the streets. So you have your age variability there. We also have the area where, when it comes to the population density, we kind of live in a dispersed kind of settlement apart from the urban areas. So if you want to speak of the response, basically we know that when it comes to building infrastructure, so I'll use Nigeria as an example. I think we started off with roughly about less than 10 laboratories with the capacity to do SARS-CoV-2 kind of virus test. And within months, we're able to ramp up those laboratories across the country. And that also speaks to many countries as well in the so-called developed nations. So it's not really peculiar to Nigeria or other African countries. And when you take South Africa as an example, we know that when it comes to epidemic and surveillances of diseases, in fact, South Africa were leading many developing countries or developed countries in the world as well. So overall, some countries did very poorly. So if you want to rate by individual countries, then when you want to base the pandemic based on the rate of fatality, you will say, well, Africa did a little bit well when it comes to the fatality. But people will also argue that what is the level of data collection on the continent when it comes to death recordings on the continent as regards to COVID-19. But again, the other way to flip the argument is, if there is high level of fatality, for instance, everyone is going to cry out loud in the public. So when it comes to the response on the pandemic, I would say it's fair enough, it was a novel pandemic when it comes to SARS-CoV-2, but I think there is room for improved facilities on what we have. There is room for proper education on the people. There's room for what it means to get vaccinated, because there is this myth that was flying around, not just in Africa anyway, but there was high level of vaccine hesitancy on the continent. Those are the areas we need to look into going forward, because we may be lucky this time, but in the nearest future, we might not be lucky in terms of exposure to diseases such as viruses.
Very well. We would look at some of those things further, but I'll come to you, Adefolarin. You work directly with the units that tackled COVID-19 in Nigeria. What would you say were some of the challenges that you faced working during the pandemic?
Well, I mean, there were global challenges actually. It wasn't something that was peculiar to what we did in Lagos State, for example. I mean, we had challenges with human resources. There was a lot of fear because initially when the virus hit, there were a lot of theories being peddled around. Even the scientific world was not sure what constituted a risk and not. And so, of course, a lot of people were afraid. It was every man for himself, God for us all. It was difficult getting personnel to see these patients. And there were a lot of inducements that had to be given to make people at least be able to work. And of course, we also had people who were able to, out of just a sense of duty, were able to do many of these things. So we had those challenges, and of course, we also had a resource problem. At some point, it wasn't about money not being available, but the challenge of getting in the right PPE, at some point, because there was a global shortage. We were not producing well, depending on China to import. And of course, China had its own share of problems. So it was a mess starting at the onset, but things got better as we moved on. Peter talked about the challenge of diagnosis. We didn't have enough laboratories, but now with the help of the SDC and the state governments, almost every state now has a lab that can diagnose these conditions. But the challenge for me really is if we had a repeat of what happened in 2020, if we had it today, are we better equipped to cope with it? And unfortunately, the answer is no. Because over the last 2 years, we've seen a massive exodus of personnel from the country. And Peter is out there, I'm sure he's one of those we've lost. Maybe even left before the pandemic, but it's really been terrible. And so many of the people that we've trained, many of the people that we've tried to equip, they are not there. These laboratories can be there, but you need people to run it. I mean, and these are not things that you just grab people from the streets and put them out there to do the work. You need experience, you need skill. If I'm working in an isolation center, I need to know that I have a team behind me, that they understand. They understand what I'm saying. I don't have to watch my back. I know that they have my back, I have theirs. And we don't have that anymore. We trained in the Infectious Professional Control Team, we trained thousands of healthcare workers during the height of COVID between 2020 and 2021 to work in various isolation centers in the state. And I can assure you, easily more than 50% of those people have left. And probably another 30% they are planning to leave. So, and that's a major problem. And I ask myself, if we have the same problems today, God forbid, this is December 2019 that COVID started somehow. And then if we have the same problem this December, boy, we're in trouble. Because most of the people we train have left. So we're going to start all over again. And that's the biggest challenge for me.
Right. I want to stay with you on the bit about resources, human resources, that is, and the fact that, since the pandemic, we've had our health workers moving elsewhere for greener pastures. Now, what would it take to resuscitate our human resource in the health sector?
Well, I mean, I'm surprised you're asking me. Peter is there, is in the UK. What will it take to bring him back?
Peter, good question. Good question. Peter, what should we do to bring you back?
So my heart beats for Nigeria, and that's established across many interviews I've done on several platforms such as yours. First, you need to have the right infrastructures in place. That is the first thing you need to have. You need to improve the remuneration of higher skilled experts. So for instance, if you're to bring me back to Nigeria, for instance, I'm a trained molecular neuroscientist. So when I come into the country, I want to have the right facilities to work with. I want to have an enabling environment to work with. I want to have required tools to work with. I'll give you a typical example. So when it comes to the SARS-CoV-2 virus. As we speak right now, if you provide me with an RT-qPCR and you provide me with the necessary reagents, I can set up an experiment on the go right now. And that is because I'm trained to do this while I was doing my PhD. If I come to Nigeria, for instance, my PhD would be more or less a paper, like useless, because all I've learned here in the UK will be really difficult to implement such skills in Nigeria. And many scientists are not really moving out of the country, or many doctors are not really moving out of the country based on remuneration alone. People want to be able to deploy their skills they've learned for years in real life scenario. So imagine you're trying to resuscitate a patient in the hospital. Does the required tools to resuscitate that individual is not there. And just because of that minor, or let me say, less significant tools, you're losing people. Look at the infant mortality rate on the continent and in Nigeria. So if you're trying to bring people back, you have to have your security in place. Many persons here, they are scared of coming home as well. You have to create your power supply. So high level of power supply should be in place. Your bandwidth when it comes to internet accessibility should be there. Your level of training at the tertiary education should be top notch. Your research facilities should come up in mainstream medias. For instance, there is no reason why a scientist in Unilag cannot collaborate with a scientist at the University of Aberdeen. But what I've realized over time is when we try to set up these collaborations with Nigerian scientists in Nigeria, there is this ego that people bring to bear. Oh, you just finished your doctorate degree just yesterday. I'm a professor in this field. Who are you to tell me what to do? But research has gone so high to the point that if someone is well trained in any form of research, he or she has the required skills and expertise to bring to bear what they've learned over time. So if you're to bring people like myself to Nigeria, just get the system working, get the right leaders in place, people that have values for human life, people that have values for education system. Your country, Nigeria, or my country, Nigeria, were on strike for 8 months. A university that is meant to produce graduates for higher education learning and produce best brains in the world. These students were kept at home for 8 months, non-stop, and the government did nothing. So that tells you, basically, if I should come to Nigeria today, I'm going to sit at home without teaching students, without doing research, without no pay, and I'm going to go on hunger strike because my services, my skills are not really relevant to the political climate in the country. And that is what we need to fix to bring people back to the country.
Very well, but Falari, I still want to come with you with the same question in that you are in the system. Tell us from your experience, how bad is it, the conditions of service?
Well, I mean, you see, unfortunately, I'm an eternal optimist. I mean, that's why I'm still here. A lot of, I mean, if I get into the UK today, I probably can go from house to house for 3 months without having to stay in an hotel. With the amount of my own personal friends and classmates that are there, and every day they ask me, "What are you still doing here?" You know, so I'm here because I believe in the country. I'm here because I believe that we can make a difference. You know, things are not too good, right? But things are not that bad either. I think it's just somewhere in the middle. We are not blind to the challenges that we face. What we try to do is, despite those challenges, in spite of those challenges, we find a way to triumph. You said you're leading yourself that it was predicted that we'll have bodies on the street. And by the time we finished our response, WHO rated Nigeria as having the 4th best response in the world. I mean, out of almost 200 countries, and that's a big achievement. That's what we did. We did by ourselves, you know. So for me, I'm just going to say that things are not perfect, but we should remember that many of these countries, they also had to go through hard times before they built their own systems. And so there's a lot of work that we need to be done here. I don't blame anybody for traveling at all. I mean, I'm here today. You may not see me here tomorrow. That's the truth. But for those who travel, there's a need to bring back their skills, their knowledge, to come back and help us to build what we have here. But we remember, this is our country, is the only country that we have, and we just have to find a way to improve things. So things are not the best, right? I mean, there's a lot of space for improvement, but I will not be here to just be rehashing all the evils and be beating ourselves on the head. I think We all know that. I don't need to recount that. But what I see also is the resilience, the strength of character of our own healthcare workers here. I mean, when you see what we go through, I mean, like Peter said, people were not paid for 8 months. And then students resumed and were expected to go back to class and start teaching them as if nothing happened. I mean, it's difficult when you go through all those things. But then still, we've done exams for the students. Everything is fine. The sessions have resumed. Patient care is ongoing. I mean, you have to really respect the people that are still here because they could easily have fled. So I think the onus just lies on us to all see how we can improve the country and work together and make our place also a place where people want to actually come to. That's the challenge for me. Thank you.
Very well. Would you say that it's time to motivate or perhaps take a second look at the conditions of service for people, particularly in the public health sector in Nigeria?
No, but you see, the reality is that in the UK, nurses just went on strike, I think last week, also complaining that the money was too small. Their lecturers went on strike some weeks ago. So these things are not, they are not as localized as we try to make it. A lot of times people, Nigeria has happened, these and that. These are global challenges. And yes, of course, conditions of service need to be reviewed. Things need to get better. My own is if the economy is better, conditions of service do not matter. I've always not been someone for advocating increasing salaries, because when you increase your salaries and then you get to the market, the bag of rice is 50,000 naira. Then what's the point? I mean, salaries have been increased, but then the rate of inflation matches up to the salary, and in fact, the salary is even worth less than what it was before. So yes, conditions of service should be improved. It's not all about money. If we create better living circumstances, you give people package systems. They have. You don't want to have a doctor who cannot afford healthcare in his own hospital. I mean, that's a disaster, and that's what we see happening a lot of times. That a doctor cannot afford to be admitted in the hospital where he's working. So those are the kind of things. You want to take over their health insurance. You want to take over their the education of their children. Allow them to focus on their work and say, look, okay, you guys, we may not pay you a lot, but we're going to take care of these other things. You're going to be fine. Focus on your work. Focus on research. I mean, you need a clear mind to be able to think of what is not lost. That's what Peter is doing in Aberdeen. He's thinking of all sorts of things. I'm thinking of, is there power when I get home? How many hours am I going to spend in traffic? Well, we thank God for the blue rail has recently been done in Lagos. We hope things will get better. But when you are thinking of all those things, it's difficult for you to now start expanding your minds and try to solve the problems of world hunger when you are hungry yourself. So yes, we can improve the conditions of service and all that, but also we have to realize that this is our country, this is our land. We have to sit down and build it. Nobody will build it for us. And for those who have left, please come back. Peter, your time is going off. Come back and let's join hands together and help us here.
Peter, that's a really great call on you, isn't it? I will not push you and ask you if you would come back. But here's a question I want to ask you. One of the things that the pandemic exposed is our social welfare system. When the economic activity slowed down or stopped in some cases, we realized that people, could not live their lives like they used to. Some people didn't have money. We had the palliative system, but we all saw what happened with it. Going forward, what actions should African governments be taking in order to strengthen the social welfare system? Peter.
Thank you for that very brilliant question. I've said this before on your platform. The first thing you need to do, stop all of your political holders from from going abroad to have your medical needs taken care of. So stop all your office holders from coming abroad for medical treatment. That is one. Stop all of the office holders from sending their wards to the UK, to the US, Canada for educational purposes. So you need to stop that. Now, when they then realize that there are no options, then they will have to sit tight and fix what they have in the country. One thing we need to understand is Nigerians are actually very brilliant in whatever they put their heart to do. That is established. If you go to the US, we have a chunk of Nigerian medical doctors right there who are actually taking charge of the US healthcare system, specifically I think California and other states in the US. So if we want to fix that, that is a first point of call. Then secondly, we need to retrain our workforce, starting from the level of the primary, up to the level of the secondary, up to the level of the tertiary education system. At the same time, when it comes to the university, we need to encourage active research. Adefolarin mentioned something about we didn't record high level of fatality in the country, and that was a success. Well, it is. But we need actual research to validate why that was so. Until this very moment, we've not been able to prove why we had such cases on the continent. That is one. Then two, when it comes to response to the pandemic as well, just ordinary PPE we could not produce in the country. Reagents to run experiments we could not. The personnel to run these facilities were lacking in these areas. And that begs for proper training on the continent and in Nigeria. So if we are to fix all of these things, everyone needs to put their hands on deck to ensure that these particular areas are lighting are well taken care of. Secondly, when it comes to ensuring that we have the best brains in the country, he mentioned that it's not all about remuneration, which is correct, but do you have adequate security? So if I should go to Maiduguri today, will I be safe to do my research without watching my back? Can I travel all the way from Lagos to Kaduna? There was this doctor, may God bless her soul, Dr. Chinelu, that died in a train attack between Abuja and Kaduna. She's a medical doctor. She was trained for more than 7 years, okay? And she just lost her life. Why? Because of poor security on those train tracks. And that is why many doctors are actually leaving. Many are not leaving because of the remuneration per se. Many are leaving for rest of mind. Many are leaving to just have a better life. Because life, of course, what is the average life expectancy in Nigeria is roughly 55 point something. So if, for instance, I'm in Nigeria today, what that means is that my chance of dying between now and the age of 55 is high. Okay, whereas if in this other part of the world, that is guaranteed that I know that, oh, there is health structures in place, there is security in place. I'm not going to be shot at by police. I've been in the UK for close to 7 years. I've not seen a gun, I've not seen a rifle, right? Mm-hmm. But right there in Nigeria, on the 25th of December, a law-trained individual was gunned down in the face of the husband. What do you think such people are going through right now? And these are the issues we need to fix to ensure that when it comes to response to diseases, when it comes to the value of human life, these are the core parameters we should be looking at to ensure that our people stay on the continent and in Nigeria. I love Nigerians so much, okay? So it's not that I'm here. While I'm here, I'm still collaborating with many of my colleagues in Nigeria. So that is what we need to do going forward.
Very well. When we come back, Folarin, I'll take your thoughts on strengthening the social welfare system in order to mitigate the inequalities that we saw peak pandemic. But I also want us to delve deeper into research and what role traditional medicine could play in future epidemics. Don't go away. We'll be right back. Welcome back to The Square. Today we have been assessing our response to COVID-19 and by our African countries' response to COVID-19 with a particular interest in Nigeria. We're doing this to project into the future and see how prepared we are for future disease outbreaks on the continent. Still with me, Adefolarin Opawoye. He's team lead for infection prevention and control with the Lagos COVID-19 response team. And then we also have Peter Imoesi. He's research fellow at the School of Medicine, Medical Sciences and Nutrition at the University of Aberdeen in the UK. Gentlemen, thank you for your time and insight on the subject matter, and I definitely appreciate your patience. But before we went on the break, Folarin, I was saying I wanted to pick your thoughts on, how we can strengthen the social welfare system in order to close the gap that we see between areas that, they have areas and they have not areas.
Well, that's a big challenge that we have to review, not just in the health sector, but in every other sector, because there's this huge gap between this huge inequality in our systems, So in other systems where, they have poor people in every country in the world, but here, poverty in the UK, for example, regardless of the money in your pocket, you have access to extremely good healthcare because most people you're supposed to be covered by the NHS. While in Nigeria, the kind of healthcare you access depends on the money you have. In fact, even in the same hospital, sometimes the kind of care you get depends on how much you have. Whether you have power or not, whether you have running water or not. So we have these huge problems, and we really need to try to improve our systems. I think one of the first things, if we're talking about strictly in the context of COVID-19, was that we have to find solutions that work for us and not take everything the white man says, hook, line, sinker, fisherman, and both. Hindsight is 2020, but we now see that maybe the lockdowns may not have been necessary. It may have been an overkill, but at the point in which almost the whole world was going to a lockdown, it was difficult for us to say, oh no, we're not doing lockdown. I could imagine the outcry and, the media, complaining and all that, So, but it's very important for us, because we're still going to talk about the role of research, but we've discovered that generally, maybe we have a different response to some of these things. For whatever reason, we're not sure. For example, we still don't know up till tomorrow why far fewer people died here in Africa than what was predicted, and that what happened in even developed countries with far better health systems than ours. So we need to know what works for us so that we don't follow what they are doing and then fall into their traps. I think that's very important. But I think generally we have to improve our welfare system. We have to improve access to care, where people can access care. A lot of people don't come to the hospital because they don't have the money to pay. And so we need to have health insurance that is universal health coverage in a sense that anybody can walk into a hospital and get good access. We have to build our primary healthcare systems. And, in Africa, our families are actually our sort of welfare system. A lot of times parents give birth to children for the sake of the children taking care of them when they are older. And unfortunately, the whole jackpot phenomenon, if you allow me to call it that, is actually removing that. When we're growing up, everybody lived within 1 kilometer, 2 kilometers of themselves, the entire family, 7, 8 siblings, all within the same radius. But now you have a situation where someone is in Nigeria, one person is in Lithuania, another person is in Estonia, one person is in Canada. Everybody is kind of difficult to provide concerted care. So when parents are sick now, there's crisis. You now start coordinating things via phone. And someone starts calling me on the phone, and don't worry, we'll send money. Chairman, it's not only money that we need. We need somebody that is here to sort of do some things that money cannot do. So it becomes difficult. So we need to start modernizing our systems because our traditional welfare packages of the family is getting eroded. The family is no longer one unit as it was before. So we need to start adopting some of the systems out there where we have a welfare system. We have a system where everybody can access care regardless of the money they have at that time. It's a big on us, and I think it's a challenge for the next government to try to see how they can do that.
Indeed. I want to stay with you on research. Are we doing some research, say in Nigeria, post peak pandemic, or we have gone to sleep because we are not recording as many infections?
No, we're doing research. So, for example, in our facilities, we're doing the Solidarity Plus trial from the WHO. I'm one of the investigators there, where we're trying to find therapeutics for COVID. But that research has stalled a bit because we've not had patients for almost 6 months now. So we're also doing research on long COVID at the University of Lagos with Lagos University Teaching Hospital where I work, where we're trying to see what's going on as to the long symptoms of COVID. So we're taking patients that we've seen over the past 2 years and trying to see what are the long-standing effects of the virus on them. Also, other viruses are still ravaging. We are doing a nationwide research on monkeypox, trying to see how it's affecting us here. So yes, research is ongoing. Of course, there are a lot of challenges, some of which Peter has tried to enumerate in his discussions. He's the research expert here. But, for example, when you're trying to publish some of this research, to publish them in high-impact journals, you need up to $11,000 to do that. Where would I see $11,000 to publish a research? So rather just keep it on the shelf or publish it in a place where people like Peter will never see it, and then they will say we are not doing anything. So those are some of the challenges that we have. We have the brains. I assure you, we have tough brains. Incidentally, one of our scientists was listed, that's Professor Dime Gorina, was listed as the top 10 researchers in the world by Nature, which is the foremost medical publishing journal, because of the work he did from Nigeria here on monkeypox. So we have very good people. We are trying to do the work. Yeah, these challenges are not helping us.
No doubt. Peter, so we've seen the importance of research to us, but that's just one bit of it. The other bit is, getting things like vaccine or looking into treatments for future diseases, or even if COVID decides to morph and turns into an outbreak on the continent. Now, are we doing anything of that sort on the continent?
Well, when you say the continent, that is really big. I know when it comes to research, Senegal are doing some research in that light. Kenya, South Africa. When it comes to Lassa fever, Nigeria are actually doing some research in that area. Now, when you say research, it's broad. It's more like a broad stroke across board. When it comes to the nitty-gritty of the research, that is where you have the challenge and the issues, basically. So if when it comes to the required tools to actually do this research are not in place, then you can't really do so much. You can list doing research, but you can't do so much. Like Adefolarin mentioned, basically. So when it comes to research or when it comes to vaccine development, it's not something you wake up today and say you want to have a vaccine for a particular disease or whatever you're looking at. You have to have this sort of research start up from the university or any form of tertiary institution that has to do with research, basically. And when it comes to this area, when it comes to our universities in Nigeria, what is the quality of research? How are these research designed to ensure that they meet the present need of the society and not just for the sake of publications? So many of my colleagues in Nigeria, they are more onto the side of trying to get paper out there for promotion purposes and not looking at the main issues on the country. So for instance, we've had malaria for decades, okay? We need to actually move at the speed of light to ensure that we have active vaccines to actually cater for these issues. When it comes to the Millennium Development Goal and when it comes to the World Health Organization and the World Bank, they actually came out with this particular document where they were discussing about the universal healthcare coverage.
Very well. And
they realized that when it comes to spending, that is the social intervention programs on the continent and in sub-Saharan Africa, though we're not really doing bad, but we're not, when you narrow down to Nigeria, we're really doing bad in that area when it comes to the social interventions. And these are the areas you need to look into to ensure that your research is actually top notch, because once you have your primary healthcare system, we're taking care of the secondary, we're taking care of the tertiary, we're taking care of, it means that the required tools and the capability of your individuals to actually carry out effective research will be there and will be able to compete with international scientists around the world. Just to finish up on research is that you don't really need to look for $11,000 to publish. There's always a consensus for developing countries to publish in this high impact journal. But the problem we have in Nigeria, for instance, is the level of research design and the quality of that research, which is not really at par with their peers in the world.
Very well. I apologize for rushing you, but Folarin, I'll let you take us home now. Tackle what role traditional medicine could play in this research that we are embarking on for the now pandemic and future pandemics, and really advise people who are going out there and celebrating, the festive season. Perhaps remind them that COVID is still around.
It's strange because despite being, we dubbed COVID warriors sometimes, but at the same time, I try not to be a fearmonger. I think people should be allowed to celebrate what they want to celebrate. If something happens, we'll deal with it. But for now, I don't want people to take excessive precautions because their mental health is also important. Some of these people, this is the only time in the year when they get to see family, and I wouldn't say you should be wearing masks everywhere. And we don't have that particular problem at the moment. I didn't see my face for months because we wear masks. But when the time for masks went, we stopped wearing them. So when it comes back, we will return. So, but for now, let everybody just take it easy, and we will all find. I know there's a current variant, like you said, you're leading in China, but so far we haven't seen so many cases here. We've seen sporadic cases of people being positive, but nobody's sick enough to be admitted. Like I told you, we have been looking for patients for months now, so that we can test drugs on them. We haven't. So for now, people should just go about their activities. When it is time to go back, because there's this real pandemic fatigue where you cannot keep people in a heightened state of awareness for too long. They're going to burn out. So for now, just chillax. Everything is cool. When it's time to go to war again, we go to war.
Indeed.
But yes, there's still a lot of work to be done, and we're trying our best. I know the challenges are enormous, but we'll just see what we can do in a bit to make sure these kind of things do not eat us unawares anymore.
Very well. I know we couldn't touch on traditional medicine and the role it could play. I mean, given our context as Africans, and what it could do for research purposes. No, we can't. Now we have to go. I apologize. Now we have to go. So we have to go now, and we are unable to tackle that. I apologize for that, Folarin. But thank you, both of you, Peter and Folarin, for joining us here on Village Square Africa. In another time, we'll talk about traditional medicine. Thank you also for your company. The holiday is out there. Go have fun. But join us again tomorrow here on The Square. My name is Keminni Amanor. Bye-bye.